먼저 현재 WHO 정신건강, 물질남용, 분과의 법률 및 인권부서 팀장이신 미셸 펑크의 추천사를 듣도록 하겠습니다.
Colleagues, ladies and gentlemen, I am truly pleased to join you in spirit for today's public hearing on developing human rights-based intervention skills in mental health care in Korea. First, I would like to express my heartfelt gratitude to two key experts whose guidance and support were indispensable to the success of this work. Professor No Jae Seong, Lead Research Institution at Aju University, and Dr. Yang Sung Kwon, Co-Research Institution Director of the Hospital. I'd also like to express my sincere appreciation to Professor Ki-san Won, who's the Director of the National Mental Health and Welfare Commission, and Mr. Lee Hyung-hoon, Director General of the Bureau of Mental Health Policy at Korea's Ministry of Health and Welfare, for their invaluable leadership and commitment towards fostering a mental health system that upholds both dignity and recovery. It is particularly heartening to know there is such strong representation here today from people with lived experience, families, peer supporters, civil society groups, and mental health providers from across Korea. This level of engagement and participation is a powerful testament to the role each of you plays in shaping a mental health system that is inclusive, respectful, and empowering. As many of you know, WHO's Quality Rights Initiative emerged in response to the critical need for a person-centered rights-based approach in mental health, one that tackles long-standing issues of poor quality care and widespread human rights violations. Across many countries, we continue to see that people with mental health conditions face coercive practices, are denied autonomy, and lack access to quality care that respects their rights, needs, and dignity. Quality Rights seeks to challenge these issues, to transform mental health systems, and to create a global movement towards services that are built on compassion, choice, and respect. Through Quality Rights, we support countries in building capacity by changing attitudes, combating stigma and discrimination, and promoting recovery and human rights in mental health care. Changing entrenched perceptions and attitudes is not easy, but it is foundational to creating a culture of respect and empowerment. We also promote participation by ensuring that people with lived experience are actively involved in decision-making and reform processes. Their voices, perspectives, and insights are critical to ensuring that services are truly responsive to those they are designed to support. As part of Quality Rights, we also support the development of community-based services that prioritize rights and recovery, supporting people to remain integrated within their communities, close to their families, and in environments where they can lead meaningful lives. And finally, as part of our initiative, we also support national reform efforts to align policies and laws with international human rights standards. This alignment is crucial for establishing a national framework that protects individual rights, upholds dignity, and places recovery at the core of mental health care. In order to equip stakeholders with the knowledge and skills essential for this work, we've developed the WHO Quality Rights Training Program. This program, which offers both in-person and online training, empowers participants to promote evidence-based human rights recovery approaches with legal capacity at its core and with the goal to eliminate coercive practices in the mental health services. Here, I would like to commend Dr. Seong-Soo Kim, whose work has been instrumental in adopting and localizing these quality rights tools in Korea. I am confident that the tools developed, which integrate open dialogue, non-coercive treatment, supported decision-making by peer workers, and recovery planning, will help drive transformative change in Korea, creating a responsive and inclusive mental health system. In addition to the Quality Rights Training Program, I also want to highlight in 2021, with the generous support from Korea's Ministry of Health and Welfare, we published WHO's guidance on person-centered and rights-based community mental health services. This guidance showcases 25 examples of good practice mental health services from around the world, demonstrating how countries can establish and scale up services that not only uphold rights, but also achieve good mental health and social outcomes for the people they support. These examples serve as powerful models for what is possible when human rights are placed at the heart of mental health care. Then in 2023, we released guidance on mental health, human rights and legislation to help countries establish legal frameworks that support deinstitutionalization, expand access to quality care, and promote practices that respect autonomy, legal capacity, and the end of coercion. Legal reform is complex, but it is indispensable for ensuring that these principles become embedded in the very structure of our mental health systems. More recently, we've been working on 2 new policy guidance packages. The first focuses on mental health policy and strategic action plans for the mental health sector, providing comprehensive guidance on how to develop and implement holistic, person-centered, recovery-oriented policies and plans that fully integrate an evidence-based human rights approach across all aspects of mental health work. The second package offers guidance for embedding mental health considerations within and across all government sectors, justice, employment, social protection, and more, to address the social and structural determinants of mental health. This cross-sectorial approach acknowledges that mental health is influenced by a range of social factors and requires a coordinated effort across different areas of government. Here, let me once again thank the government of Korea, whose financial support has been instrumental in the development of this guidance. We look forward to launching and disseminating it widely next year, and I am confident that it will serve as a vital resource for countries committed to advancing mental health and human rights. Let me finish by saying that today's public hearing exemplifies the transformative power of collaboration and commitment to human rights and mental health. Your coming together for the public hearing demonstrates a dedication from key stakeholders throughout Korea to build a system that respects and upholds human rights. WHO remains committed to supporting Korea in this important journey. Thank you very much.